everyone. This is the chapter on evaluating. Here are the learning objectives for this chapter. Please take a moment to review these. Also take a look at the key concepts, key terms, and the NCLEX questions at the end of the chapter with the rationales. So nurse and patients together measure how well the patient has achieved the outcomes that have been specified in the plan of care. The nurse identifies factors that contributed to the patient's ability to achieve the expected outcomes, and when necessary, also determines when they didn't achieve it, and then will modify the plan of care based on the feedback received. The purpose of evaluation is to allow the patient's achievement of expected outcomes to direct future nurse-patient interactions. And it's important to note that the final step of the nursing process is evaluation, right? So you're going to go back and you're going to talk to your patient and see whether or not they actually met that goal. So there are 5 elements of evaluation. So first, identifying the evaluative criteria and the standards for that criteria, collecting the data to determine whether the criteria or the standards have been met, right? So like I said just a minute ago, you're going to go back to your patient and have a conversation with them, right? And then what you're going to do next is you're going to interpret the information that you just collected, and you're going to summarize the findings, right? You're going to document the judgment that you made based on those summarization of the findings. And then finally, the final step, or the 5th step, is modifying the plan of care and then continuing, with the updated plan of care. Or if they actually met the goal, then you're just going to terminate it, right? Once you've met it, it stops, and then it stays in the patient's record, permanently in their permanent record. But then you move on to the next other things that the patient needs to focus on, right? Next goals. The 5th step of the nursing process, again, is evaluating. So we must evaluate our patients to see if they actually achieve the desired outcomes. Did they partially achieve those desired outcomes, or did they completely miss it, right? And the patient just got worse, right? This step directs the nurse whether or not we need to modify our plan of care, whether we need to just continue the plan of care. Yeah, it's working, but we just need a little bit longer, or whether we need to remove any problems from the list, or again, they reached the goal, so we're terminating that plan of care now. So, evaluative criteria that we use, and we're going to compare that to like standards that are used out there, right? So first of all, criteria, I'm having a hard time saying that today, is measurable qualities, right? Or measurable attributes or characteristics that identifies the skills, knowledge, attitudes of our health status. So you'll hear Marcella and I in class, talk about skills, knowledge, and attitudes as well when it comes to the nurse, right? So in this case, excuse me, good Lord, we have the skills, knowledge, and health status of the patient, right? So literally describing the acceptable level of performance by stating the expected behaviors from your patient, right? And then next is our standards, right? So this is the level of the performance that's accepted by the nursing staff or any of the other healthcare team members, right? So of course, the standards in our field are set by whoever's the authority in your field, right? And they're detailed and they're custom to that patient and all of those things, right? And so that's the difference between criteria and standards versus criteria versus standards. Okay. There are 5 elements involved in evaluation. So first, evaluating helps identify evaluative criteria and standards. It evaluates the performance or response by the patient, and it also evaluates the performance of the nursing staff as well as the other healthcare team members, right? Evaluating is comprised of literally assessing the patient, gathering data to determine if the patient met the outcome goal. So after you collect the data, the next step is going is going to be to study that information, and you're going to interpret that data so that you can make an accurate judgment on whether the goal was achieved, partially achieved, not achieved at all. The next step is to document the judgment. This is done by making an evaluative statement. So first you state if the outcome was met, if the outcome was partially met, or if the outcome was not met. Then the second part of that statement is the data you gather to make that judgment call. If the patient only partially met it or did not meet it, then you must include a third part in your statement that includes what you're going to do about it, basically, right? What you're going to adjust or implement or change to fix the fact that they only partially met it or didn't meet it at all, right? And I want to tell you to stop at the end of this last sentence that I'm going to say. I want you to stop your recording, go to your book, because your book has some really great examples of these evaluative statements. So please pause and take a look at those. Also, common problems can occur when you are evaluating and when you're doing the evaluating. This can trigger the need to modify that plan of care, right? It's when you realize, okay, wait, I see where I went wrong, or where, the plan of care that the patient and I came up together, where it could have been a little bit better, and you're going to tweak it, right? You're going to change it. So again, your fundamental textbooks gives really good examples of this process. So please pause it, take a moment and review it. There are 4 different types of outcomes a patient can achieve, and they include cognitive, like learning about their disease process, psychomotor, like learning how to give themselves an injection, right? Affective, affective, affective is like, for example, quitting smoking would be a great affective. And then physiological, so all of the physical things like patient's oxygen saturation levels coming back up or returning to 98% or above, right? The other thing we evaluate is if the patient achieved the goal in the time frame that we established initially, right? If the patient achieves the outcome goal, we also should acknowledge and celebrate the achievement with that patient. So definitely you want to encourage them, right? Because they were successful in doing it. If the evaluation judgment is that the patient only partially met the goal or did not meet the goal, then the nurse must try to identify the causative factor on why the goal was not met, right? Were the nursing instructions wrong? Were they erroneous or vague? Or were they, detailed, but they just weren't carried out? And that's many times the case. So you need to ask why. You need to get to the bottom of it with your patient, right? Maybe the nurse set the goal too high or too soon, right? Maybe we wanted to achieve, 2 times around the nurse's station, 1 person assist 2 to 3 times per shift, and we only were able to do one round once around the nurse's station 3 times a shift, right? Whatever that looks like, right? Maybe we're too aggressive with it, and that's okay. We just need to adjust it. But the end goal is to investigate these possible causes, then to prepare to modify or delete the nursing diagnoses, or make the outcome statement more realistic, or increase the complexity of the goal statement, right? So you really genuinely have to get to the bottom of where the plan went awry, and then fix that piece of it, right? And then create that new goal statement, one that is has all the pieces of it, right, with the updated plan of care that can be reached and achieved at the next interval, right? So, okay, variables that affect whether or not a patient's able to achieve those outcomes, right? So, of course, patient, nurse, and then, of course, the healthcare system. So those 3 variables are the most. When you go back to try to figure out why exactly did we not achieve this goal, and you're having conversations with your patients, it's going to come down usually to either something with the patient, right, or something the nurse failed to do or didn't do thoroughly enough, or literally it's a roadblock because of a healthcare system issue that exists, right? So, for example, patients, the cardiac guy, right? He's on board when he's in the hospital, right? Because he doesn't want to have He doesn't want to have another close call to having a stroke or an MI. And so he starts his cardiac meds, but then a week in or 2 weeks in, he starts having erectile dysfunction and he just completely stops taking it, right? So that's an example where the patient didn't comply. Nurse, now, excuse me. There's a lot of examples, right? I gave you one just a minute ago where we set the goal too aggressively, right? So we adjusted the laps around the nurse's station from 2 to 1, right? It also could be, we're seeing a lot of nurse burnout right now because I'll be honest with you, it's a little bit challenging in the medical field right now, right? We have a huge nursing shortage, and this affects, unfortunately, will affect your job satisfaction sometimes, and you can get burned out, right? And so that is a piece of it. You may figure out when you're doing that interview with your patient after the evaluation, right? You're going back and seeing where the breakdown was. It could totally be the nurse, right? And then, of course, the healthcare system, right? So what I just mentioned about the inadequate staffing, that piece, if it's just inadequate staffing, that's a healthcare system issue, right? And it's like we got to make them realize that these 5 to 6 to 1 ratios are ridiculous, right? It's not safe. Um, so actions based on that discussion and interview with your patient, right, to the plan of care, right? Um, so we are either going to modify the problem statement, right? Or we're going to completely delete it and recreate it entirely because it was just completely wrong. Or we may make the outcome statement more realistic, right? 1 lap around instead of 2, right? As the example. Time criteria in the outcome statement is a critical component, right? And we said that, right? We want to have a very specific time frame. And then altering the nursing interventions. Maybe the nursing interventions were not appropriate like we thought initially, right? So we're going to alter those as well. Sometimes nurses run into problems with delivering their care in the healthcare settings they work at, and the Institute of Medicine suggests 10 rules to redesign and improve care. They're listed on this slide, so take a moment and review them. As nurses, we are always striving to improve our patients' performance. I'm sorry, our patients' outcomes as well as our own performance, right, to achieve optimal patient outcomes. So you instead of complaining about the situation truly, you really need to do something about it. So we have the power to change policies, procedures, environments, patient outcomes, all of these things, right? And of course, there's power in numbers, but I want you to know that you individually have a lot of power. And the fact that we are the patient's advocate, you need to utilize that power, and you're going to need to utilize that and have those conversations that are rough, right? And what I will say is this: if you're new to those conversations, yeah, it'll be a little nerve-wracking in the beginning, but it's amazing how quickly you become. You get a little outer coating per se, so things don't, words don't really hurt you anymore. It's just like you just want to take care of your patient, right? So just keep at it, right? Once you discover a problem, let's say, the next step is to plan a strategy to look into that problem. You want to create a campaign to implement whatever change it is that's needed. Implement it, and then you want to go back and assess the change, right? Did it work? If the change is still not to your expectations, then you're going to plan a new strategy and try again, right? Your fundamental textbook gives some really good examples on the steps in this process, in this performance improvement process, right? So take a moment, pause the video, go in and look through those, right? Because again, they're going to give you specific patient examples, which is how you train your brain to critically think, right? Peer review is also a very valuable process in nursing. So just asking someone to come in and watch you give feedback, come in and watch me do this and give me feedback on how I can improve. Oh my God, it's so helpful, right? And we do that a lot. If you're a great nurse, you do it all the time, even if you're new. Of course, you do it a lot more when you're new, but today I'm a novice nurse, right? Because I'm new in the field, and then I'm an expert, right? Because I've been here 10 years. But then I change, and now I'm going to go work from. I started neuro ICU. Now I'm going to go to the ED. Guess what? I'm a novice nurse again, so I better be asking the peers who've been in the ED for a long time how to do things down there, right? So as nursing instructors, we do this all the time with one another, and it can really help you get better at your job and at your skill, right? 7 crucial conversations in healthcare. Okay, this is important. So, not speaking up when you see shortcuts being made or people that you work with making poor clinical judgments is very hazardous to your patients and their outcomes. You have to speak up. If you raise these issues and speak up, you could make a difference in your patient's outcomes and potentially save a life. Okay. This slide lists those 7 categories of issues. Your fundamental textbook also goes into detail on these and gives examples as well. So please pause the video, open your book, and look through those. They're very important. Okay, the American Association of Critical Care Nurses, my peeps, right, developed some standards for establishing and sustaining a health work environment. They stated that you must be clear and proficient in your communication. You must foster collaboration. You must be valued when you make good decisions. We have to have adequate staffing to meet our patients' needs. Really, the institutions really need to value the nurses for their contribution to the healthcare team. And it has to be authentic, right? It's one thing when it's authentic and another when it's just, something like an email that's just sent in random, right? It doesn't feel genuine and authentic, right? And it has to be. You really got to make your staff feel valued. A visual of this is on this slide. So pause it and take a look at it. Improving performance. So evaluative programs help improve performance. We're going to revisit this at the end of the semester also because it's so important to be knowledgeable about these programs and get involved in them when you're a nurse. Quality assurance programs promote excellence in nursing by making the nurses accountable for their practice and their patient outcomes. Quality by inspection focuses on finding deficient workers and removing them. This approach may foster staff hiding errors and may not be the best approach. Quality as opportunity focuses on finding areas for improvement and promotes an environment that uses good teamwork. Mistakes are viewed more as a problem within the system or a process as opposed to a problem with the person themselves. The ANA model of quality assurance program focuses on quality of care, structure, processes, as well as outcomes. A structural evaluation focuses on the environment of care. This could be the facility, maybe the equipment, maybe organizational policies and procedures, or the fiscal and personal resources. It focuses on all of that, right? A process evaluation looks at the nurses carrying out the nursing process correctly and effectively. Outcome evaluation looks at the patient's outcomes after nursing care has been delivered. Quality improvement is the committed approach to continually looking at every process that we do within every part of the organization, and it always strives to meet or exceed expectations, right? I was the quality improvement nurse at one of the home healthcare agencies I worked for. I looked at everything from how long it took for the physicians to sign and return plans of care to how many patients were rehospitalized. Again, like I said before, within 30 days of being discharged, right? Or what could have been done to improve, patient outcomes. So we're looking at things like this all the time. We're always looking at things to improve patient outcomes, right? Patient satisfaction is also a very strong tool for our community to assess, prior care to the patients when they were in the hospitals and to gather information on how they felt, whether or not their goals for their plan was met, right? These tools ask questions about communication, pain control, timeliness of care, discharge instructions, cleanliness of the facility. I mean, just like literally everything, or overall treatment of everything of the patient, right? These are made public. Institutions are held accountable for these results, and their goal is 100% patient satisfaction, right? Nursing sensitive quality indicators is information that captures care or patient outcomes that are most affected by nursing care. Okay, that's what it is. And this may be the number of incidences that occur, like pressure injuries or pressure ulcers, or maybe patient falls, because that's a huge one, or maybe even normal staffing ratios versus patient outcomes. So, because of the uptick of how many patients we have to take on now, they look at all of that, right? Next on our list, concurrent evaluation is done by observing nursing care in action. So, literally, like interviewing our patients and doing chart review while the patient is still in the facility receiving care, right? Retrospective evaluations is after the patient actually leaves the facility, right? So this can be done by questionnaires or like at Honor Health, we call the patients who've been discharged, we call by phone. And then we also do chart reviews. So our team will also go in and look at chart reviews of patients, especially ones that bounce back to see maybe where the gap was at, right? All right, this is the end of the chapter on evaluation.